We also mentioned some of the drugs which actually causes the low sperm count and other predisposing factor like age as someone gets older. And I'll be able to talk about this. But today I learned something just to mention about age. As someone grows up, your testosterone level actually reduces. But at this time, two of your hormones also increases. And so these two hormones, number one, we have the hormone oxytocin. And number two, we have an hormone mostly in ladies, but in this case we are referring to male. It's called the prolactin hormone. And so these two hormones, are actually one of the causes of infertility as someone grows. So we'll be able to see this in a few. So I've talked about varicocele as one of the causes of low sperm count, infections, hormonal abnormality, some types of medication like the steroids. Yeah, it's okay. We also have stress. We also have age, and of course others like think about radiation and those chemotherapy things. But I don't want to talk about that. I'll be wasting a lot of time because I think we've talked about this over and over again. So right to our today's presentation. Let me now join with this other device so that we now start. Good. So let me share my screen now. Fine. I think you can now see my screen. Someone can just respond.
It is visible.
Okay, thank you so much, James. Good, thank you so much. So let me go direct to what I want to share today, and then we'll call it a session. Direct to what I want to share today. Directly to what I want to share today. Fine. So I want to mention two more conditions. Then just in very few minutes, then we will start. We talked about erectile dysfunction, and we mentioned all this as causes of erectile dysfunction, which included the cardiovascular issues. We have the diabetes, we have neurological conditions, we have hormonal imbalance, we also have obesity, smoking. People are under medications like the antihypertensives, for example. We have antisteroidals, and those who are smoking actually are also susceptible to this. And we also talked about psychological causes like stress, anxiety, depressions, and also self-esteem and relationship issues, and also lifestyle factors, e.g. lack of exercise, poor diet, sleeping disorders, and all that we talked about. Good. So today we want to start at this condition called epididymitis or epididymitis. It just depends with how you pronounce it. But basically, this is the swelling or inflammation of your epididymis. This is a place where sperms are actually stored after production from the testes, as we saw. So when there's an inflammation, it basically means that there's an infection, number one. Or number two, it basically means that there's abnormality in terms of maybe physical attack, or maybe someone has just had a physical attack. But in the main cause of inflammation in men of this organ is actually infection. And so when we talk about infection, mostly we can refer to Neisseria gonorrhoeae, that is a bacterial infection, where we also have other bacteria like chlamydia. We also have this one called pneumoniae and others. So any inflammation will indicate that there's an infection. And when an infection happens, actually, your temperature basically rises. And so when you have fever because of inflammation and someone tells you, just go and take Panadol and you know you'll be well, then that person is lying to you. Panadol will just reduce the pain, but not treat the infection. So in such cases, you really have to find the cause. I'm not saying you don't use Panadol. That will just, actually, you should not use drugs because we learned over and over again, even the analgesics which can help us. So compare the two. Compare the two in my diagram. So an inflammation will just appear like the second photograph. It will swell, and you know it's just beside the testes, and so you'll hear or you'll experience a lot of pain, and this pain radiates to the back. The second condition I want us to think about, okay, well, this is just an explanation more of this condition. So how do you see, like, someone complaining of the redness of the penis or the redness of the scrotal redness? The scrotum is sometimes swelling, there's pain, and there's also just a very chronic or a very, a very acute low abdominal, or someone is just complaining of, the pain in the pelvic regions. So this is just an indication that these people are experiencing epididymitis. So other symptoms are also there, like for example, someone is having a urinal change where you frequently pass urine or abnormally pass urine. And so this is not an ideal symptom, but it's one of the symptoms which can be presented. So I want us to question something. So that is the first condition I've been able to mention. So the second one is called an hydrocele. Hydrocele is just where there's a fluid-filled sac that occurs around the testes. So when there's a fluid-filled sac around the testes, and there's no pain, you're not feeling pain, but you are feeling like this, your volume, like your anatomical orientation in this case, is not just fine. Sometimes it comes with inflammation as well. But so basically, there should not be any fluid filling anywhere around your testes. So if it's the sort of increase in testicular volume, and it's not on the epididymis, and so this is called an hydrocele. Most often it's not presenting with pain, but it's an abnormality. And its management, it's very simple. Sometimes you can have a varicocele where there's just an enlarged vein within the scrotum, which can affect the sperm production and quality. We talked about high heat, mostly to men. And we said when you expose your scrotum or your testes to high heat, it makes the sperm production, the sperms being produced at that time, to be sterile. And so when they are sterile, you are predisposing yourself to, number one, low spermatogenesis process. Number two, you're also predisposing yourself to nocturnal. We'll be able to see this in a few nocturnal production of sperms where you involuntarily produce sperms at even when you are not in orgasm. So we are yet to see this. I want us to now have a case study. How do you go about? What are some of the first things you have to really check before doing anything about male infertility? So we'll start from investigation. How do we investigate such conditions? Then from investigation, we'll move to management. So in investigation, we start from the general, claims or just the general clinical presentations that someone is complaining. For example, the general one, someone is complaining of chronic back pains, and sometimes they can be HIV positive or their triple serology test, that is HIV, hepatitis B and C, is actually showing that they are positive. And so these are predisposing factor to start questioning the reproductive system. So hepatitis B, hepatitis C, your blood glucose is quite high. We talked about diabetics being a predisposing factor to the high blood sugar or high blood glucose, and number 2, thyroid functions. We'll be able to see this in a few. So, and vitamin D levels. So this is the first general presentation. Chronic back pains, triple serology testing, HIV, hepatitis B, hepatitis C, and blood glucose in such case. So if they have this and they are complaining, they're complaining of maybe infertility, then these are some of the predisposing factors. So what happens after assessing this? We now move to hormonal assessment, where we will assess their follicle stimulating hormone, luteinizing hormone, the thyroid function hormones, but the most important is a hormone called testosterone hormone. So when it is low, then this will now be an indicator that they are actually having hormonal insufficiency. And we also talked about other hormones like gonadotropin releasing hormone, which are just secondary hormones, not very much important in the primary investigations. Then after this, now we'll question the genetic line. So in the genetics, sometimes it's because of karyotyping. And we talked about a case where someone is having, for example, Y chromosome abnormality, and also cases where someone is having, for example, instead of having XX, someone is having XXY, XXY or XY, XXY, X only, or maybe XYY cannot be. Yeah, such conditions. So they're chromosomal or genetic abnormalities. And so after this, when these are just okay, then we'll now move to ultrasound, maybe MRI scanning, and maybe semen cultures, and even DNA fragmentation. But in a case where someone is having conditions like enlarged prostate and prostate cancer. Enlarged prostate, quite difficult to tell, and unless otherwise you do the ultrasound or MRI scanning. But a case where someone is having cancer of the prostate glands, then in such case we now do TPSA. And we said last time that men above 40 years of age should actually perform a regular TPSA test to assess their whether they're just okay, they don't have, or they're not developing the prostate cancer. So this is in terms of investigation, general, hormonal, genetical, and others. So we said last time that now when you now narrow down to now the examination of maybe the semen, so that you rule out maybe ejaculation problems and semen production problems, then you consider all this. I'll not mention this because this is quite, I talked about it last time. So we'll talk about the ejaculate volume around 1.5, then the pH, then 1.5 milliliters. Then we have forward progression about 32, and all this. These are done in the labs. So after that, now we'll now have a specific, and I told you this is a case study, because you cannot just see a man and say this man is important. This man is infertile. It's very hard, lest you be called to be judging. Good. So let's now go to specific Good. So let's now go to management. This a condition called nocturnal emissions, or spermatorrhea. So this is where someone is involuntarily losing their semen without orgasm, and this is one of the causes of low motility and low mobility. Low motility, that is to say, like low sperm, movement, and also it's actually attributed to low sperm count because it's the sperm semen, it's the semen itself, or it's the alkaline fluid we talked about, which number one neutralizes the acidity media in the female reproductive tract, and also it's this alkaline media which is part of the semen, and it's from the prostate gland, which actually gives the sperm the ability to move and find their way to the oviduct, to the oviduct. And so here comes a case where someone is involuntarily losing their sperms, their semen, I mean. And so this is a condition called nocturnal emissions. Nocturnal means it's day, it's night, night. So what are some of the causes? What causes such? So we said the other time that the scrotum or the testis itself must be a half a degree cooler than the normal body temperature. But when it becomes overheated by maybe taking a hot bath, or maybe just staying in a very hot environment, or we also talked about maybe handling your laptop on your laps and as you study and all that, anything that can increase your temperature, then this will actually make the sperms to be released at night. Most of these things happens during the day. And so when the body becomes overheated by taking out bath and all that, a release of sperm will be made in the night, since the supply of sperms has been damaged. And so if you sleep too warm at night as well, due to an electric sleeping blanket, I think you've seen them. If you've not seen them, you Google them. I also don't know how they look like. So when there's an overheating, the testicles will eject sperms the next day. And so major causes are actually unnecessary sexual stimulation. For example, someone is constantly watching, pornography. Someone is just constantly viewing these things which are stimulating their reproductive system. And so, as you stimulate it, every part of it, including the prostate gland, is stimulated. And so this is one of the major reasons why those who are having how is it called? Okay, well, the name is going. The name is going. This is one of the reasons why those who are undergoing innate. The name has gone. I'll remember it and I'll tell you. So overheating is one of the major causes. Number two, visual or thought sexual stimulation, and even poor diet. So and masturbation. That is the word I was looking for. Masturbation. This is why explains why those who are masturbating and actually having low ejaculate volume, and most of them are potent, by the way, as time goes by. Someone who has masturbated for 2 years, it's very rare for them to really be fertile. It's very hard. So I'm talking about possibilities. So good. So in such cases, what do we do in such cases? So number one, reduce the temperature, the body temperature, reduce the exposure to heat, reduce the visual thoughts and the visual and thought sexual stimulations. Just reduce them, and you make sure you're also taking a very balanced diet and other supplements which also helps you to improve the spermatogenesis process. Include zinc. So when we talk about zinc, you can go for zinc supplements or you can go for zinc rich foods. So zinc rich foods actually has been associated with mostly the dairy products, but you can do better. We have whole grains. We also have seeds like the pumpkin seeds. We have sunflower oils. They are very rich sources of zinc. Pumpkin seeds, we have sunflower, we have flax seeds, we have also whole grains, we have almonds, we have cashew nuts, and we also have peanuts. Someone can just add any other source of zinc, So that is the first consideration. So even as I talk about this, I'm generally talking about potency. After making your case study, after doing your case study, after doing one-on-one evaluation, until you're now sure it's maybe the process of spermatogenesis affected, or maybe any other thing. So what are you supposed to do? So good. So number two, about so number one is zinc, number two is essential fatty acids like flax seeds, and you also have we also have pumpkin seed, and we also have alfalfa. Then we also have vitamin A, the beta carotene. So in this case, we'll refer to majorly carrots, and we also have vitamin C. Vitamin C, these nuts, but basically, most of the vegetables and fruits are very rich with most of these vitamins. So vitamin C, talk about citrus fruits and all that. Then we have this compound called selenium. Selenium is actually one of the okay, how can I say, one of the constituents that make up very, very viable sperms. So they are found in supplements mostly in supplements. So you can consider that, but we also have the natural sources, which I'm not sure of. Here I'm sure of just the supplements. And we also have this nutrients called the lycopene. The lycopene mostly found in tomatoes, and these tomatoes must not ripe to their fullest. So you know that sperms are just proteins, like, okay, proteins with DNA, and also, so even as you consider proteins, you have to consider the amino acids, because these are the building block for proteins. So the major amino acids in this case, we will talk about the alanine, the glycine, and the glutamic acid. So these are majorly found in almost all the proteins that you know, almost all the proteins. So this very important vitamin called the folate, or vitamin B, which is very important in sperm production. So I've given just a general meaning here, and which we can actually subscribe to. Now, I'm still talking about general principle. So, I see somewhere my slides are reaching, so that I see how to go about it. Good, fine. So that is to say about a general point of view. Just a minute, I see something here before we can continue. Kidogo. Fine. Good, just a minute, something really. Okay, well, so we talked about foods, some of the foods that can increase your sperm count in a case of low sperm count. And I want to add on the addition. So number one, zinc supplements. We've also talked about, let me just get to that slide so that I move you. Good. So number one, we've talked about zinc complements, and so other sources which you can also subscribe to. And this is lifestyle. This is not just nutrition. It's very impossible. It's very impossible to increase your sperm count with only one type of food. It's very impossible, because this is like a chain involving DNA. This is a chain involving hormonal balance. This is a cycle or a process involving your metabolic rates. This is determined by the thyroid gland. This is a function that involves every other mitotic and meiotic process. So this is a chain that you have to really subscribe to. So think about nuts, think about seeds. And when we talk about nuts and seeds, think about nuts which are essentials, having much of zinc, that is almond, walnuts, the flax seeds. We have fruits and vegetables. Then we have citrus fruits and tomatoes that is rich in lycopene and vitamin C. Then leave alone fortified cereals. So we have the bell peppers, increases your metabolic, rates as well, so that it maximizes. Then we have sunlight, which is directly associated with vitamin D, very essential in making sure that this process is also optimized. Then we have watermelon, also a great source in minerals and vitamins as well. Then we also have whole grains. Then most importantly now is, okay, not most importantly, I said this is a chain, so it's of equal measure in terms of benefits. So we have exercise, which actually helps you to maintain and also maximize on your hormonal profile, exercise, sleep. And we talked about sleep the other time. Someone is having a 4-hour sleep, and which is even interrupted, and they want to be, really fertile. It's nearly impossible because your spermatogenesis wholly depend on growth hormone also to aid this process. And so when you're not sleeping, you're not relaxing your body to produce growth hormone to help in growth, then you're actually not doing well. You are actually predisposing yourself to infertility in that case. So these are some of the points that we have to really consider. I've also talked about the peanuts. Think about taking much water. Think about having regular sleeping patterns, exercise, and all that. Good. So I want to go to another area now to mention about potency. To mention about the male potency. So, do you know, like when you take only 1 spoon of your sperm, it should contain like 20 million sperm. Okay, well, 15 to 20, but about 20 million sperms in a 1 teaspoonful. So, so when we talk about potency, we are talking of any number less than 15, less than maybe, let's say 15, 20 there, 15 million, I mean. So, the causes of this are actually 2, which I've been able to talk. But now, let's now go to how can you, what must you start with? And what you have to start with is what I've presented. So, other things that you have to consider is number 1, gluten. Actually, gluten is a product from wheat, and so gluten has been associated with reducing the reducing or linked to the male impotence. And so, if anyone is taking gluten, scrap off. If anyone is taking much of this dairy product, tell them to reduce as low as possible if they can, and if they can, the better method will now just give it to scrap them off, so that they can also actually monitor their change effectively. And so, if anyone, you have to take history about alcoholism, because alcohol actually generally reduces your performance, and we saw this in our last class. So, talk to them about their occupation and about it. This must just be reduced. And some people are just complaining of impotency. Today, we went to a certain seminar, and they were linking temperance. They were talking about, part of the discussion was about temperance in even sex, temperance in sex. And someone said something interesting, that the amount of energy used for one ejaculation, like one time ejaculation, is the same as the energy you use when you are taking a 10-kilometer walk. 10-kilometer walk. So think about it. One of the things that drains men is sex. And so scientists has advised that if you also want to increase your chances of getting children, not getting children, but conception. In a case you realize you're not doing very well potently, then you should not have an intercourse for several days or some days prior to your special fertile time. So this has worked, and this has been also proven. So think about it as well. And it reaches a certain time where someone is having low sperm count, and so people are suggesting to them artificial inseminations and maybe surrogate motherhood and all that. I've never seen that supported biblically, and so I, as a medic, I won't tell you like that is the way to go. Though I've seen such happening as well, but you guys can also give a thought on the same. I really think surrogate motherhood is not the way to go, but I'm still debating about artificial insemination, where a sperm is taken and injected into a female oviduct physically or just manually. So think about it. You can tell me your answers in the chat box, whether you think this is right or wrong. So that is true. That is like generally about impotence, male impotence. So what are some of the things that you should also consider when you are now dealing with male impotence? Number one, we have cold bath. If it's a case dealing or to do with the overheating of the testicles, then cold baths will really help. So when you talk about cold bath, generally advise on taking bathing with water with below. Let me just say below 20 degrees centigrade, and even 20 is too much. I'm not sure how much is much, but around 15 there. Isiende sana pia. But the best is actually below 15 degrees centigrade. So 20 and above, quite many. But when you are now doing the cold bath, then you have to do it with water below 10. And this should take you like 5 minutes. And so this is capable of reducing the testicle temperature to 5 degrees below the body temperature. And this also increases this process of spermatogenesis. You know how we do hot seat baths. So instead of now using hot water, you use cold water. And instead of now using it maybe in the whole body and all that, now you do it to the testicles. Good. Fine. So I want us to continue a little bit. I think we can go to the slide before we can go to the slides. I think now I can go back to up there. 26. Up to there, do we have any question? Do we have any question? Something you've not got clearly up to where I've reached? Yes, Philip. Before Philip, think about this. Some of these conditions are very hard to really manage. Some of these conditions are actually, for example, talk about anatomical conditions. These are nearly impossible. And if there's a procedure that must be done surgically, then that is the way to go. Yes, Philip.
Okay. At the condition where I am at right now, I can get some break. So, what if I look for you later or tomorrow during the daytime so that I can I can ask more questions on your DM? Will you mind that?
Okay, fine. I won't mind that. It's okay. I won't mind that.
Thank you.
So fine. We are not done with this class. There are quite more bits. We'll not even dive into the remedies, but we'll be done by 9:30. So, do you have any addition, any question up to there? And maybe you can also tell us what do you think about inseminations? Yeah, thank you so much, Denzel. Selenium can be found in your nuts and vegetables, and mostly whole grains, these whole grains and your vegetables. So it's one of the major factors that contribute to increase spermatogenesis. Good. So silence means there's no questions, so I will just continue. Unfortunately, my net is failing me now. Let me rejoin. Here ni fine. Okay, iPhone. Here later. Logo. Okay, well, guys, we can just continue because my net is not working. Good. Fine. So I want us to mention some of the herbs that we can use for someone who is potent, but of course, relating to which conditions. So, you all know about these sexually transmitted infections. And when we talk about sexually transmitted infections, we go to conditions like chlamydia disease, we have gonorrhea disease, we have syphilis, we have HIV, and what else? Okay, there are quite a number. So anyone having this sexually transmitted disease, mostly the major cause always is bacterial infection, because all that I've mentioned is bacterial. So when it's in such conditions, then you have to get an antibiotic for this. And one of the natural antibiotics we know, the most powerful antibiotic, which is not very readily available, is golden seal. But we also have others like echinacea. We also have ginger and garlic combined, but mostly ginger. Very strong antibiotic ever seen. And the strongest antibiotic is actually the sun. Actually, the strongest antibiotic is the sun. And so think about it. So in this line, we have to really deal with the infection first. So STIs and also the urinary tract infections. So in such cases, you have to start from managing the bacteria, managing bacteria and the infection at large. Now, in a case of epididymis, or maybe there's just inflammation of and I've also said that this is majorly due to infection as well. So this is still the way to go. But besides that, you can also use anti-inflammatory and antioxidants drugs. Herbs. Good. So in a case of let's say in a case of maybe hydrocele, this one you really have to go to the hospital so that they can also help you to remove the excess fluids, and also do it in a way which is professional, because if you just do it and you can predispose yourself to much. Good. Fine. So when you talk about prostate conditions, but this one will mostly talk about when we now handle the female part. But when you talk about thyroid conditions, because thyroid determine your metabolic rate, and also thyroid is a thermostat to your body. The thyroid gland is a thermostat to your body. so that in a case where someone is having hyperthyroidism and you get like this hyperthyroidism is presenting with fever, and this fever is increasing even the temperatures of the testicles and all that. So in such cases, you have to really deal with managing hyperthyroidism first, because after dealing with the thermostat of the body, then you'll be helping even the other organs and all that. So I said this is a case study, so you have to really work from cause to effect. And you also have to really work, in such cases, you also really have to work with the doctors and the scientists closely. Because, for example, when you say about hormonal testing, testosterone level, how will you do it? How will you do it? So, think about it. Good. Fine. I can see some responses. Vincent Okoro is saying that artificial insemination is a subject of controversy, but personally, I believe it's unbiblical. People are just looking for shortcuts instead of following God-given plan. Well, nice. Man is saying the Bible teaches that pre-creation is meant to take place in the exclusivity of marital union. That is Genesis chapter 1, verse 27, and Genesis chapter 2, verse 24. As I said, by the way, this is a very controversial subject. And some people are actually reasoning that, people have become creative so that even as you inseminate, it's just a matter of creativity, and you're not closing any other person's line. Because if it's a spouse to spouse, still the same. And some are saying, consider cases like, for example, the Bible, people are potent or people are infertile in the Bible. Why couldn't they even subscribe to other ways? Then other people will say, technology was not there right then. But I really don't want to make a conclusive statement about this. It was something, just a thought. Good. So up to where we've reached, do we have any questions? Because I want to do the last part of this, then we'll just call it a presentation. So I forgot to mention this. This herb called the black cohosh, mostly used in women with hormonal imbalance. So it is also recommended in men who have hormonal imbalance. That is to say, they are not producing mostly the reproductive hormones, like the follicle stimulating hormone, testosterone, and the luteinizing hormone, and even all this. So what happens is that this is a herb which actually just balances, so that if there's an overproduction, it balances. And we also have yellow dock. In female, we also talk about yellow dock and also chamomile. And so when we talk about yellow dock, it's almost the same dose. But chamomile can also be used to do the cold bath. The cold bath I talk about. The cold bath. Now, so there are these other factors which are very important. Like, talk about stress, managing your stress levels. Very important, because with your stress level high, it basically means your cortisol level is high. And so when your cortisol level is high, you cannot really do what? Produce good melatonin and the growth hormone responsible for these processes. So at all costs avoid stress. And one of the ways to avoid stress is to have adequate sleep, to have regular and just exercise, and also to really deal with your stress, like find the cause and deal with it. Good. Fine. So let me try to present my screen once again, if I'll be able to do it. I really want us to see something here. Then we'll just call it class. You can see we have like 15 minutes. Today we'll stop at 9:30. Fine. So we have also been able to talk about the prostate disorders. And these disorders include where the prostate gland has actually increased in size, that is enlarged prostate, or we also have inflammation in the prostate gland, that is prostatitis, and also we have prostate cancer and prostate hypertrophy. I think we didn't talk about hypertrophy. But so, in such cases, mostly, these people will present with like abnormal urination. That is to say, either frequent or maybe delayed, but mostly it's frequent. And even the urine detection period is quite affected, so that they can really not retain their urine appropriately. And they can also have seminal discharge, and also the nocturnal, the one I started with, the nocturnal seminal production. So in such cases, it can be something acute, something like just happening right away, something that is not delayed. It can be something acute or something which has been chronic. Yeah, so it can be something which has just something acute, that is something which has just which is happening like abruptly and takes some time, then it goes, or something which is frequently happening. And so when we talk about frequently, maybe they having burning urination, or sometimes they are presenting with blood in their urine, and mostly in such instances they are complaining of lower back pain and the pelvic region pains, and they are even not able to copulate. So gradually, these are just flags to tell you that you have problems with either the kidneys, the urethra, or it's a reproductive disorder. So in such cases, don't assume such symptoms. Never assume such symptoms. So if it's such, make sure you see a doctor. And if you really know like the problem, where the problem arises from, for example, if you are sure it's about the kidneys, because kidneys is also closely related to this, then you can also use drugs like this common one called the Prunus africanus. Let me write it in the chat box so that you see. This one called Prunus africanus. Yeah, Prunus africanus. For all urethral conditions, it's very good, and it also clears the UTI problems and even the infections. So this is one of the herbs that is very essential in such. So good. Fine. So I think I'll stop there. I think I'll stop there because I can't really project my. Oh, it's prunas africanus. Fine. So, do we have any addition? Let's start from any addition because this